Hey guys, so good to see you. Happy Tuesday. It's Talk to Me Tuesday, and I am really looking forward to talking about something that I believe is essential for us as a society to be talking about. And I hope that people are already talking about this, but if not, let me get this conversation started. But before we get started, let me know that you're joining me, that you're here right now. Put a 1 if you're tuning in live right now, and let me know what area of the country or world you are tuning in from. And then if you end up watching this later on the replay, then put a 2, and also let me know where you're tuning in from. So what I'm going to talk about today is related to the importance of health and the importance of health going the whole way back to before a child is conceived. And as a speech therapist who's been working many years, I have been noticing and concerned about the number of children who are having overall learning, language, behavioral problems. And every day when I'm working with them, it's clearer and clearer that this is the case. And I have also noticed quite a few cases that are very upsetting, very concerning, that when I saw the child and all of the challenges that they were experiencing, when I ended up looking deeper and seeing what was the history of the child, how was the health of their parents? How was the mother? How was the father? Were they using any types of drugs or certain substances? It seems to be that quite often I end up finding out that the birth parents, one or both, were on some sort of substance or multiple substances perhaps. And it explains a lot about the child and all of the learning challenges that the child is demonstrating. So let me give you just some statistics that I found regarding substance abuse by parents, either during utero when the baby is developing, and also, going through the pregnancy, and this I hope will give you shed some light on what I believe to be true and I've seen firsthand, but just adding some research and statistics. There's a lot of articles out there about this particular topic. So this is from the Journal of American Academy of Child and Adolescent Psychiatry. You can go to jaacap.org. That's where I found this article. There was a research article in April 1st of 2002 that found that children with ADHD were 2.1 times more likely to be exposed to cigarettes in utero, and also 2.5 times more likely to be exposed to alcohol in utero than the non-ADHD control subjects in the study. So double to 2.5 times more likely to have ADHD if exposed to cigarettes and alcohol during a pregnancy. Smoking has been shown to lead to things like preterm birth, so a child being born sooner, low birth weight, and even defects of the mouth and the lips. And since I do speech therapy, kind of important, right, for a child to have a mouth and lips that are developed normally. So it's important to consider the choices that you make or the choices that other people in your life make can certainly impact whether or not a child is born with brain abnormalities, certain physical defects, difficulty regulating their behavior. So this led me to really ask the question, how about all of the medications and toxins that people are putting in their bodies today? If you've listened to some of my previous videos, I have shared with you my personal concern about the number of medications that people are on. And it's not just the elderly anymore. It used to be, people in old folks' homes having all kinds of drugs, being drugged up. And that certainly, I think, is still happening quite a bit, unfortunately. But it's also becoming that a lot of young people, they go to the doctor and they end up leaving with a prescription or more. And every time they go to an appointment, they might end up collecting prescriptions. And before they know it, they come to me as a health coach, because I do speech therapy and health coaching. They come to me and they tell me that they're on 5, 6, or more medications when they're only in their 20s and their 30s. And a lot of times people are coming with medications for mental health challenges. And so I think as a society, we need to really start focusing on this and not being so focused on what the media is portraying to us, which often tends to be drug commercials and wanting us to add more medications to the list of already long lists of medications. But what we really need to be looking at is, what are the potential ramifications of being on these drugs, whether in the past, currently, or going forward, and how does that impact not only your health, but the health of your children, your future children? And so I think it's important for us to consider things across time, not just, well, I think I need this now, and so I'm going to do it, but thinking about what are the possible consequences of the things that you are doing now. And so consider the number of medications that you are currently on. Also, consider the number of medications you were on in the past. Have you already had children? When you had your kids, were you on certain substances? Maybe you thought, oh, it's not a big deal. I'm just going to take some pain reliever because my back hurts. And while pregnant, you ended up taking certain medications. Often we think about the woman, and that's certainly very important because the woman's carrying the baby. But have you ever considered, guys, have you considered your role in this and how your health impacts the child from the time of conception? So if you're somebody who hasn't had kids yet, but you want to have kids, consider your history, consider what substances you've been on, consider all of that going forward if you have not, and consider the impact of the decisions you're making right now and how that could impact your future children. I want to give you a really enlightening picture of how crucial development is from the time the baby is conceived. So did you know that at just 10 weeks after a baby is conceived, all of the major structures of the baby's brain and spinal cord are recognizable? So what is that? You think about 2 months, a little bit over 2 months, the baby's brain and spinal cord are all recognizable. And so if a mom is using substances early on and may or may not even know she's pregnant, you can see how this could be a major issue for that developing baby. The brain grows very rapidly in utero, and any interference, so again, it could be smoking, it could be alcohol, it could be marijuana, it could be pain relievers, it could be opioids. We know how bad of a problem that has become. It could be that your body is being exposed to different toxins just simply from breathing the air around you. Maybe you work or you live in an area that's very polluted. Maybe you're simply just drinking the tap water in your area. If you don't pay attention to these things, it's time to start paying attention. There are a lot of toxins, a lot of substances that can certainly impact child development. And then look around and see the number of children who are dealing with learning disabilities, language disabilities, difficulty controlling their anger, controlling their behaviors, being very impulsive, and then we can see where ADD, ADHD as a label comes in, right? And then fast forward to when these kids go to school, and I work with preschoolers. Imagine trying to teach a class of children with a large number of them running around the room, having difficulty focusing, getting into things, not listening to the teacher, not listening to the staff, and just bouncing around pretty much, like a ball, like a ping pong ball. Those are some of the kids that I've worked with quite often over the years and currently. And it's pretty, as you can imagine, it's pretty hard to teach a child or teach someone who can barely stay focused for 5 to 10 seconds. So this is a major issue for schools and people who are caring for these children, and also for the parents who are trying to care for these children. So it behooves everyone to consider this and try to do better in the future going forward. So again, with the brain growing very rapidly in utero, any interference can significantly impact the growth of the baby, their physical growth, their behavior, their cognition, which is their attention, their memory, their ability to learn, for their brain to work and recall things, for overall intelligence and communication skills. You name it, if the brain growth is impacted, it's going to affect many things for that child going forward in their life. Sadly, often children that have been exposed to one substance are often exposed to multiple substances. There are, situations that I've heard in the past of, a pregnant woman going into a bar and having a drink or multiple drinks, or taking their young child or a young baby into a bar. Like, how is this not going to impact these children and their lives going forward? So you name it. Toxins are toxins, chemicals are chemicals, whether it's in the air, in our food, in our water supply, in over-counter medications that you think are not a big deal. If you are eating food, like I mentioned food, if you're eating food and that animal that you are eating was given medications, which many of them are, that is also coming into you indirectly, but it's still coming into your body. So these toxins can come in from so many sources. But obviously, directly consuming drugs like tobacco, nicotine, marijuana, cocaine, opioids have already been shown to have a major effect on a baby's development and can affect attention, visual, perceptual skills. If you have a child who's sitting there and trying to put together a puzzle, but challenged so much, can barely figure out how these puzzle pieces are oriented, and they don't even know to really turn the pieces, so confused, that's a sign that it doesn't mean that their parents were on drugs, but it shows they have visual perceptual challenges, and it's important to think what might be causing this, what has created this visual perceptual problem. And even, so I said about the behavior problems, the child could be very sweet, but if they are impulsive and getting into things, not listening to their teacher because their brain is moving so quickly and they're just bouncing from one thing to the next, these kids end up getting in trouble a lot, and that affects their likability. It affects people, wanting to work with them, or, some kids get kicked out of daycare these days because the staff simply cannot manage the behaviors that these kids are exhibiting. And you fast forward as the child's getting older, if they got kicked out of daycare, what happens when the child's older? They end up getting in trouble, and they may be exhibiting delinquent behavior that gets them into a lot more trouble and ends up getting them involved with the law. And so you can see how, again, this is a major issue. Parents having drug use or being exposed to toxins before having children, or while the baby is developing. Thanks so much for tuning in, David. I'm talking about toxins, and I do speech therapy with preschoolers, and I've seen a very concerning trend over the years and even this school year, where I have discovered that some of the kids that are demonstrating some major attention issues and learning challenges have a history of basically being on drugs, being on substances alongside their moms, alongside their parents, and it's just no wonder why these kids are struggling. And so, like I said, I want you to consider, what do you use? What have you been exposed to, not only now, but in the past? And if you want to have kids in the future, consider the impact of your decisions on your future children. Also consider how your health is helping, like if you currently have children, your health and how serious you take it, how much you're valuing your health, you are teaching that to your children and being an example to them. And so if you're not taking your health seriously, that is setting an example to your children of maybe how much health is worth it to you, and they may start to consider that their health is worth similar to how you value your health. I love helping parents and families, and I love to combine my knowledge of communication, speech and language, with my knowledge of holistic health and wellness. So if you're in need of support, and you might be struggling with your health, you're wanting to be a better example to your family and your children, you want to eat healthier but you're not really sure how to do it, or you know how to do it but you have trouble staying consistent and accountable, you need that support and accountability, which most people do. Otherwise, you fall right off the horse pretty quickly. Don't wait until January to be like, oh, it's resolution time. Now I'm going to do it. Now now it's important. Get started now so that you can get going on it. And, basically what you're doing when you put it off is you're just simply delaying feeling better and feeling your best. So why wait longer? I like to ask people, what is your health worth to you? Let's think of a number. If I came to you and I said, you know what? I know you really, really want this certain item. And, let's say you want a new car. And I say, you know what, I'll give you this car in exchange for your health. And this car is worth, let's say it's $40,000 or more, maybe, depending on what car you want. Is it worth it to you? Would you sell your health to me or to someone else for $40,000? What is your health worth to you? As someone who went 7 years with chronic digestive issues, low energy, had difficulty getting to sleep, ended up having joint pain in my hands and feet that lasted for quite a while. And I ended up seeking out help for over the course of 7 years and had a lot of difficulty getting adequate help for it. I know how much my health is worth. I know that it is priceless. It is the foundation for everything else in your life. And when you're not feeling well, everything else is impacted. Basically, you think of it like a house. What happens if you try to build a house on rocky, not solid ground, right? What if you just skip the step of pouring a strong foundation for your house? What is going to happen to that house? It's going to shift. You're going to end up with foundation issues later on. The same thing is with your life and with your health. If you think you're going to skip over health and you're going to reach a new level in your life without addressing your health problems, think again. So I hope this helps you. I hope it motivates you to stop putting off your health and stop putting off things of value, and really making sure that you're being the best you can be. Reach out if you need help. I do have a few openings for one-on-one health coaching clients, and I would love to see if I could, if we would be a good fit to work together, and see if I could be of support to you and your family if you have kids and have a family. Be well. Thanks for tuning in. Bye.